The calcaneus is a pretty large bone, and you generally don't see a lot of problems with that, but there are two that I wanted to touch base with as we continue talking about foot injuries. The first is retrocalcaneal bursitis. This is exactly what it sounds. It is an inflammation of the bursa there at the calcaneus. And remember, you've got two bursa that are there, but we're talking specifically about the retrocalcaneal bursa. The mechanism of injury for this problem is generally one of two things. One, you have an overuse with running, or two, you have direct pressure from poorly fitting shoes. Women who wear high heels a lot will oftentimes end up with this bursitis, and you will hear it called a pump bump. Oftentimes you will also have localized swelling, redness, point tenderness on the bursa, and in chronic cases that bursa will actually start to thicken and will maintain that way, hence that pump bump. Range of motion wise, you may find pain with active and passive range of motion during plantar flexion. The treatment that you want to do, well, get yourself better fitting shoes, but if it is to the point where you can actually see that, you will want to probably put in a donut pad to help pad the area so that the shoe doesn't continue to rub on the area. The other calcaneus issue I want to touch base on is the calcaneal apophysitis, which is known as Seaver's disease. Apophysitis, remember, is an inflammation of an apophysis. An apophysis is a place where you have a tendon attachment growth area. So you're going to see this calcaneal apophysitis in young, skeletal, immature athletes. In Seaver's disease, the signs and symptoms are going to be posterior heel pain. There's going to be point tenderness at that area, and you will find that there is pain with weight bearing, running, jumping, activities that kids like to do. As you can see, this almost looks like there is a fracture in the area, and so this is obviously a condition that needs to be referred to a physician so that it can be taken care of.